Dr. Hossami, I'm curious. Tell me a little bit about the professional team that you have available here, their qualifications, where they've studied, and what's brought them here to Verita Life.
Now, Verita Life, as I mentioned, it is a part of a big group. So we always have a scientific board or a medical board that is always overseeing all the clinics that Verita Life has, from oncologists, professors, even, let's say, immunologists, also professors in immunology, and so on. So, and clinical-wise, we have myself, I'm the medical director of Verita Life Bangkok and the head of integrative oncology for Asia Pacific Verita Life. We have also Dr. Adam Gunas, who is the chief medical director. He's a very well-known integrative oncology doctor, all right, from around the world. We have also mainly oncologists, as here in Thailand we got 2 radio-oncologists, Thai doctors. We got a naturopathic doctor as well to go through nutrition and supplements and for the supportive side of treatments for the patients as well. And in every clinic we have always a medical director, we have a medical oncologist or radio-oncologist as well, and so on. So mainly we are always talking about highly qualified medical doctors that is always taking control of the clinics and treating patients.
And not only highly qualified, but in my personal experience of having spent some time here, also very friendly, very easy to get along with, and they do such a fantastic job of explaining the treatments to the patient.
Well, it is, because now the patients are always there putting their trust in us. Absolutely. Especially when we have patients that conventional treatment has failed. We are their last hope sometimes, so that always we have to be, let's say we are, at the end, we are like a family for them. So they come, a patient comes here, they have to spend 2 months, maybe 1.5 months of treatments every day. So making it very formal as how the relationship always between a doctor and a patient is not very supportive and helpful for a patient. So we always have to be friendly, we have to always know what they are suffering and what's their complaints and what's their concerns even about treatments or about their situation and their cancer, and we have to always address this and go with them through these treatments.
Yeah, and something that I've found really beautiful at this centre is, you've got the communal dining area, you've got this area here with these chairs where your patients are not sort of locked into separate rooms, everyone's sitting together almost like a family. And it gives patients an opportunity to communicate with other patients, in regards to, what's going on with your health, how are you feeling, what was your experience, and I think that helps a lot.
Exactly. Psychological-wise, they need to have the support, and also another thing we saw that patients supporting each other's when someone has, for example, any side effect or any complaints or anything, so when they share it with each other, they know that, this might be common, it's all right, there's no problems, they feel more safe.
Absolutely.
But being locked in one room, for cancer patient, cancer is a death word, right? They always have this, but here we always try to take it out from them and make them think in a positive way, which they all share together, nothing is hidden here, right? So they all know what is the treatments, they all know what is their situation, how they are improving as well, and how things are going with them. So that's what makes it easier for them as well to spend this long time here, 6 or 8 weeks, or even 10 weeks.
And speaking of, making it easy while they're here for 6 to 8 weeks, I found your reception staff and your admin staff fantastic, even when it comes down to things like, where to go shopping, where to buy food, where to stay, what kind of accommodation. Everything seems to be looked after here, every single detail, which makes it really easy, not just for the patient, but also the carer or the family member, the relatives that come along as well.
Yes,
so
definitely. Yeah. Especially it's people it's the first time for them to come to Thailand or go to Germany or to Mexico or any of our clinics from overseas. So they always need help, they need support with the country and where to go and what to do, where to eat for the relatives and so on. So this is always has to be supported for them as well.
And for a lot of people, they may not have travelled overseas before, or at least not been to Asia before. And when you create this beautiful family atmosphere, and you have a very multicultural sort of clinic with people from absolutely everywhere working here, it makes it really easy, I think.
Yes, for sure.